If you've been using AI to self-diagnose your groin pain as a sports hernia, you need to watch this whole video because you may be being misled. I'm going to go through some basic AI searches today to show you where they went wrong, and also I'll give you more relevant information of potentially how it can improve. This is a basic AI search of sports hernia diagnosis test. So we can figure out here where AI went wrong. Sports hernia is diagnosed using physical exam and imaging, such as ultrasound and MRI. I wouldn't necessarily disagree with this. AI says that we need to make sure the doctor checks for a bulge in the groin area and also ask the patient to stand, cough, or strain to make the hernia more present. This is not correct, okay? This is an exam for a hernia, an inguinal hernia, an abdominal hernia, a femoral hernia, but not a sports hernia. In case you're wondering the differences between the two, we have a full write-up and a free book below in the link description that covers that difference. A sports hernia is more of a muscular injury. It's not an injury where the abdominal contents exits out of the abdominal cavity. The reason why they're called very similarly is because there was a bad name given years and years ago, which we haven't gotten away from. In current literature, you'll see the name athletic pubalgia, which is a better describer of actually what we're dealing with here. Now here's another paper which shows why those are actually incorrect with physical exam. This paper covers 245 different people who had athletic pubalgia diagnosed. The similarities that we find in their physical exam come down to contraction of muscles, not coughing and sneezing. What they found was the test of the adductor contraction against resistance with an extended knee was positive in 77.6 of the people evaluated with athletic pubalgia or sports hernia, same thing. Also, simultaneous contraction of the hip inflection and abdominal flexion against resistance was positive in 76.7% of those 245 cases. We can also see in this paper what similar symptoms people had. Symptoms improved at rest and worsened with practice of sports, running, and walking. Another 13% had pain with sexual intercourse, 11% with sneezing, and 8% with coughing. So as you see, there is a relationship, but only 11 or 8% of those relatively had pain with sneezing and coughing. So why is AI saying this is the best test for it? It's not. Now, once physical exam has been performed, sometimes an advanced image is needed, and AI is not wrong on this. And so it goes on to say that imaging such as x-rays, ultrasound, CTs, MRIs can be used to detect injuries to bones, nerves, and soft tissues. Imaging can also help rule out other possible causes of pain. So this is all correct. And one other thing that AI is actually good for is brainstorming other possibilities. So I actually went into Gemini and asked other possible differential diagnosis lists that could be associated to having groin pain, and here's what it said. Muscle strains, tendinitis, osteitis pubis, stress fractures, hip joint problems, inguinal hernias, femoral hernias, kidney stones, testicular torsion, epididymitis, UTIs, appendicitis, and the list goes on and on and on. So don't necessarily use AI to pinpoint a diagnosis, but I think looking at these lists to figure out what are the possible things that it could be, and presenting these to your doctor, I think are a very good idea. We can use things like AI to help us expand our thinking, but I think narrowing it down is going to take a skilled healthcare provider to be able to do the examination with you and help rule out these other conditions, reasonably speaking. If you guys are looking for help, take advantage of our free PDF, the 6-step sports hernia recovery program that we put together here because it is very confusing, as you see. But if you guys are looking for help too directly with us, reach out. We have virtual and in-person services. Subscribe to the channel. We'll see you next time.